Bureau from Bedelia wants to know what the legislature is going to do about nursing home funding, particularly in rural areas, indicating that that's an area of concern. Who wants to take a run at this first? Can we start with you, Representative Portman?
Sure. It's an area where, again, I really am hopeful we could find some bipartisan agreement. I think that there's a lot of shared concern about the level of funding for nursing homes and care facilities that provide all different levels of care. And it is a bigger issue in greater Minnesota, but it's definitely an issue that all of us are dealing with in our communities, whether we represent suburban areas or parts of greater Minnesota.
Senator Benson, what are your thoughts?
The legislature just went through a process of re-equalizing the rates, and so some of the nursing homes are getting adjusted rates now. They maybe haven't fully impacted their budgets, but one of the big concerns with nursing homes is, first of all, do we have beds in some of the rural communities that need it? Because we have a restriction on nursing home beds, and we have to literally come to the legislature to trade beds between communities who need them. So we might need some adjustments in that legislation, but they have workforce problems. They're having trouble hiring RNs, LPNs, and especially in greater Minnesota, sometimes it is tough to find people who are competent to work in these environments, and so I think that might be a better place to target help. We did just adjust the rates. Let's let those settle for a little bit, and then let's work on workforce.
Representative Aldridge?
I think, to share Senator Benson's observations, it really is about a conversation about workforce development. When you're working in an environment where the complexity of a person's healthcare initiatives are tantamount to maybe requiring an MD on staff, and you're getting paid $11 an hour. So I think we need to really take a look at not only the reimbursement rates, but captivating the desire to provide service in that area for a wage and a career path that is fulfilling. I think that's going to be a very, very important conversation that we take up in the House, particularly. And I think that points to the fact that we actually dedicated, because of its import, a subcommittee on that very topic, where we're going to undertake a very thorough undertaking in terms of how do we address the aging of a population. I mean, most of us around the table are getting to an age where we start to think about what's going to happen to us when we get to the age of retirement.
Only you. Speak for yourself.
It's just you and I, Representative. The other people here are so much younger, it's not an issue for them.
But saying that, I think there's a lot to be said for the respect that is owed to the aging. And they are not disposable. I think the whole idea that retirement means that you're not of value to society is really almost offensive to me. And so I think that we need to enter into not only just the reimbursement rates and the career paths, but also how do we engage those older generations in feeding and investing back into the younger generations what they've learned, and cultivate an opportunity for the younger to learn from the older.
Senator, rural nursing home funding.
I'm really proud that the Senate under DFL leadership has really made some important commitments, I think, to nursing care, because we know how important it is, and particularly in greater Minnesota. And the logistics and the workforce issues are very serious. In these small towns, not only is it important to the residents and their families, they're also often a major employer in these communities. So there's a sort of a bigger economic ripple effect that is important that we pay attention to. So we need to keep focusing on it.